Hi, my name is Kale Evans. I'm a student nurse here at Wilson State College, and this is my re-recording of last week's skills video, which was drying up and administering insulin. So my first thing I'm going to do is I'm going to check my provider orders with my MAR that has been given to me. So on my provider order here, I have Shirley Coast, 54-year-old female with a date of birth of 5/14/1964, and that matches my MAR here, Shirley Coast, 54-year-old female. With a date of birth of 5/14/1964. So that all checks out. So then I can go on with checking the insulin, or the medicines on the provider order to the MAR. So my first one is the NPH insulin U100, 15 unit subcut with supper, and then that matches here on my MAR. NPH insulin U100, 15 unit subcut daily with supper, so that's right. Next is demo dose regular insulin U100, 10 unit subcut twice a day. And that matches here on my MAR, demo dose regular insulin U100, 10 unit subcut twice a day. And then lastly here is Lispro practice insulin, Lispro U100 insulin pen with a mild sliding scale subcut 3 times a day with meals. And that matches here on my MAR, practice insulin, Lispro U100 insulin pen, mild sliding scale, subcut 3 times a day with meals. And I know that my that Lispro is the fast acting, and it starts within 5 to 15 minutes is when it starts activating once given. And I had a CNA go into Shirley's room and check her blood sugar since we're getting supper time, since it's getting to be supper time, and at 17:10, the CNA reported that the client's blood sugar was at 276, and with that blood glucose, I can go to my sliding scale, and with 276 being in the 251 to 300 range, I know that I'm going to be giving 6 units of the Lispro. So now that I've finished with that provider order, I can go on with just my MAR, go into the med room, do my hand hygiene before pulling the meds out of the patient's bin. So just to make sure I got the right patient's bin, on my MAR I have Shirley Coast, 54 female, 5/14/1964 for the date of birth, and that matches here on my bin. I have Shirley Coast, 54 female with date of birth of 5/14/64. So my first med that I'm going to be pulling out is a NPH insulin U100. So that's going to be one of these vials here. So here it is, NPH U100, 100 units per mil. And I have Shirley Coast, 54 female on it with the date of birth of 5/14/64. So I know that that's hers. Next is that demo dose regular insulin U100. So it's going to be this other vial here. Regular, 100 units per mil, U100. And then I just match it to her name here, Shirley Coast, 54 female, date of birth of 5/14/64. So those are correct. And then lastly, I have that U100 insulin pen with the mild sliding scale. And that's what this is here. It has her information because this is just her pen. Patients don't share these. So it has Shirley Coast, 54 female with a date of birth of 5/14/64. So that's the last of the medications that I'm going to be needing. So now I can go on to my second med check, which is actually when I draw up these meds. So I'm going to put on some gloves that are slightly too small. And go on with drawing these up. So before drying them up, before disinfecting them, I want to shake them and mix them. So here's that regular insulin. So I'm just going to roll it, shake it. I don't want to shake it because that can create air bubbles, so you just want to roll it like this. If you want, you can invert it. Do a little bit more. Just kind of do this for about 10 to 15 seconds. And then go ahead and put that down, and then go on to this other one. This NPH, this is that cloudy one, so you want to make sure that nothing's settled on the bottom. You want to make sure it's evenly distributed, and when you notice it looks a little cloudy, you know that it's alright because it's not supposed to be clear. That's what the R1's for. Okay, so now that I got those mixed up, and this one, like I said, looks cloudy, I can go on to disinfecting them with their own alcohol pads. We're just going to do this for about 10 to 15 seconds on each. Next one. Okay, so those are disinfected and ready. And I'm going to disinfect that one when I get to drying it. So for these, I'm going to make sure I want to know how much I'm doing. So for the NPH, I'm doing 15 units, and then for the regular, I'm doing 10 units. I'm going to want to pressurize the NPH first, and then draw up the regular first, and then draw up the NPH, if that makes sense, because I don't want the needle of the NPH solution touching the R solution. It's not supposed to mix because it's cloudy, and you don't want that to get murky. So I'm gonna do that NPH one first. So we're gonna pull 15 units here of air. So there's my 15 units. Okay, and then we're just gonna stick that right in here at the top. Okay. Then we're gonna pull again the 10 units that we're gonna pull from the regular insulin. So there's my 10. We're just gonna go right into the regular. And we're gonna hold an invert and then pull that 10. Okay, pull that down, and I'll just have the camera double check that I got 10. Okay, and then we're gonna pull that last 15 out of the NPH here, and that'll be a total of 25 units. So I don't wanna push up, I just wanna go straight down. Okay. So we're at the 25 right there. Okay. Now we're going to do the scoop technique to recap. And then we're going to get our label out here to make sure we have the correct labels on it. So I'm going to write for insulin 1, I'm going to put the NPH 100. We got 15 units of that, and then the regular 100. We have 10 units of that. I'm going to sign my initials, date and time, so we're at 17/15, and today's date is 10/7/18. Pull that off and wrap it around this. Okay. There's that. Okay, and then next I'm going to pull this pen here. And before I do that, I gotta make sure to disinfect it. About 10 to 15 seconds as well. this little needle out here. It's going to go straight in, twist on until it's tight. Then we said that we're doing the 6 units, so I'm going to pump it up to 6. So here we're at 6. Oh, before that, I'm going to do it to 2 to make sure that I can get some of it to come out. So here I have it at 2. Then I'm going to do it here. Okay, so both of those came out. So I know that there's no air in the way, so then I can go to 6 here. 5, 6. And there's the 6 mark. And then with that, I'm going to recap here. And then before I take this into the patient's room, I'm going to have another nurse come in, double check before I leave the med room, so to know that I have pulled the correct amount of insulin. Let me do this instead. Okay. So after another nurse has come and verified with me, I can then take the insulins into the patient's room, as well as my MAR. So my second check's complete. I'm going to go into the patient's room here. Usually I have a tray, but I don't, so I'm just carrying these in. Okay, knock knock. How we doing, Shirley? We doing good? Alrighty. Yeah, so is that meal you got in front of you look appetizing? Yeah? Alright, just what you wanted, perfect. So I'm here, I got your insulins here for you. So I just need you first just to verify your name and date of birth. Okay, Shirley Coast. 5/14/64, perfect. And then I just want to check on your band here, Shirley Coast 54, 5/14/64, and that matches my MAR here. And then, do you have any allergies, Shirley? Yeah, you do, to codeine. Right. Is that what it says here? Perfect. All right, that matches up. Perfect. Okay, so I got your NPH insulin and then your regular insulin as well. And then at home, do you usually draw those up and give them together? You do? All right, perfect, because that's what I got for you today. And then I also have your Lispro. And then for your Lispro, we're doing 6 units today because my CNA came in earlier and got your blood sugar and it was at, yep, that's what it was at, 276. So, where do you usually give your shots, Shirley? In your stomach? Okay. So we'll do one on one side and one on the other, that way that they're not hitting each other and hurting you, alright? So first we're going to do this NPH and your regular mix, so I just want to make sure I got it right here. NPH for 15, NPH for 15, and R for 10. R for 10. Okay, so that matches my MAR, so we can go ahead and give this. And, oh, here we go. We gotta get this going here. Okay, so first we gotta wipe your skin down here. Starting in the middle, going outside. Okay, and we'll throw that away. Alrighty. So we got this pulled out here. And I'm gonna pinch. We're gonna go straight in. Ready, Shirley? 1, 2, 3. And we're gonna go nice and slow to go too fast. I'm gonna do about 1 mil every second. Okay, we'll pull that out. We'll let that go there. I'll do this little safety cap. Okay, and then we'll administer that to the sharps. Okay. Is that too bad, Shirley? No? Alright, perfect. So now we're going to go on to that Lispro here. And we got to just make sure that we're still at that 6 units here on the pen. And we are. We still got that 6 units here. Okay. And we'll just take off that cap. And we're going to go to that other side here. And we're just going to not let your skin fall off. And we're going to wipe you down again here. Start in the middle, go on the outside. Okay. And then for this one, we're going to do a pinch. And then we're going to go straight down and hold it down. And then we're going to hold it there for 10 seconds to make sure it stays in there. Okay. And then we'll release. And then the safety is gone. So then I can then turn this, pop it back into that with the scoop, and get rid of the sharps. Okay, we got no more insulin, so administered all 6 there. Okay, and then I got the cap for it in here. So I can take this back to the med room when I go. So I'm just gonna make sure that Shirley's I'm gonna visually check that she's gonna eat the food in front of her. That's why I checked to make sure it was appetizing, because if not, I probably wouldn't have given that Lispro, because it's a fast acting and it needs food to be right in front of the patient. I'm gonna do hand hygiene. I'm gonna make sure that the patient's comfortable, they're sitting all right, they don't need anything from me. I'm gonna clean up my mess that I made in the room if I did. And then I'm going to go back to the nurse station and chart, put any meds that I didn't put back into the bins, and that'll be it.